like that. I see my mentor, Dr. Krishna Prasad here. Hi, KP sir.
Hello.
So most of what I've learned, many things are from KP sir. So sir, any tips sir
Sir,
for
comments
us?
by you, sir.
I think it has been already very well covered, as Dr. Kunutur said. I think one point I always tell my postgraduates is try to distinguish between phaco and SICS in terms of capsulotomy. Basically, capsulorhexis, which has no, a radial straight tear. So it is basically that in a phaco where you do a lateral separation and you stretch the bag, the rhexis comes very handy. So basically, the role of Rexis in phaco is something different than the role of Rexis in SICS. Basically, most people want to basically graduate to phaco, so they do Rexis in SICS learning curve, which sometimes, as Dr. Lakshmi alluded, they end up doing a smaller Rexis in order to make a Rexis. If the nucleus is around 8 millimeters, and the nucleus is big and hard, and nucleus is a three-dimensional structure, it has a thickness also. So for that to come out of 5 or 6 millimeter Rexis, is impossible. So this disproportion has to be kept in mind. So whenever a novice is actually doing a Rexis in an SICS situation, they should always think how to get this nucleus out. So many a times they make a Rexis, they struggle like getting the nucleus out, damaging the anterior capsule, posterior capsule, or the zonules. And many a times it haunts them in the later part of the surgery. I think it's very important just to get an idea. The idea, see, in an SICS, there are two problems. One is to get the nucleus out of the bag. The second is to get it out of the eye. So to get it out of the bag, the Rexis becomes a hurdle. So they should probably keep that in mind. Many of the problems originate for beginners in this disproportion. So I think that is very important. Whereas in a phaco, you can probably do a phaco even in a 4 millimeter
4
Rexis
millimeter.
because you don't have to get the nucleus out of the bag. So I think keeping this, and this was very well covered actually, I think this will go a long way in the beginners. But anyway, everybody has to learn how to do a Rexis because that is the way most of us will probably be doing a capsulotomy. Having said that, that is not a must. SICS with a can opener or a large Rexis with multiple radial cuts will also do the job. That is very important to keep the capsulozonular integrity. But as you said, there are certain situations like intumescent cataracts, fibrotic capsules, I mean, subluxated cataracts. So for that, we need to probably apply a different mindset. But for most cases, the routine cases, I think this sticking to basics will always help. I think it's a very good discussion on a very important topic. Congratulations to both of you.
Thank you, sir.